The California Department of Public Health's Environmental Health Investigations Branch had worked with APA in the San Francisco Bay Area community for years. Together, we spread the word that some fish can contain harmful levels of mercury. Asian people have traditionally had diets that include rice, fresh vegetables, and fish. Most fish are good to eat a few times a week. Many people in the community rely on fishing to add to their diet. But fish that people catch in the Bay Area and many parts of the world can have mercury and other chemicals in them. Rice noodles, and traditional remedies also can have arsenic or other harmful metals in them if they're grown in soil with high levels of these metals. APA requested that we partner on a biomonitoring project to help educate members of their community on making safer choices. Biomonitoring is a way to measure the chemicals in a person's body. It can tell us which chemicals are getting into people and at what levels. To do this, scientists test for chemicals in samples of blood and urine. What we learn from biomonitoring studies can be used to help keep harmful chemicals out of our environment and the products we buy, and out of our bodies.
My name is Alexander Nguyen. The Chinese-speaking community in San Francisco, they consist of low-income, non-English speakers. Our communities are isolated through language barriers, our racism, our segregation, our different types of things. What we do is provide services.
APA recruited 100 people from their community to participate in what is called the ACE project. Participants gave blood and urine samples. They answered a survey about how they might have come into contact with the metals and chemicals tested in the study. We found that ACE participants had higher levels of mercury than the general population. And 1 in 5 participants had levels of arsenic that were above a level of concern in their bodies. We sent participants their individual results, showing how their levels compared to others in the study and to other people in America. We included information about each chemical and how people could reduce their contact with it. We also held a community meeting to share the overall study results.
The overall benefit is that the community realizes that there are agencies here that are willing to get engaged and involved with them and see what their needs are.
Our studies have helped identify communities that come into contact with toxic chemicals more than other communities. And we can apply what we learned in these communities to California as a whole. This project looked at chemicals in a Chinese community in San Francisco, but what it tells us about chemicals in rice, fish, and other foods can be used to help improve everyone's health.